right. Well, welcome.
Thank you. I'm so excited to be here.
Yeah. So, maybe we could talk a little bit, just let people know how you and I met. And I don't, I'm going to invite you to kind of briefly introduce yourself.
Right.
I think it was a while ago. I don't know how many years that you and I met. So maybe we
Sure,
could
we should
talk about
admit how
that.
many years. It was a really, really,
Been a while.
really long time because I came in and I interviewed with you for my pre-doc internship at
Oh,
San
I
Jose
totally
State.
forgot about interviewing you. Okay.
Yeah, you were my interview and we bonded and talked about Asian American mother issues. And I saw how wonderful and sensitive you are. And
Oh,
I remember thinking, like, I really, really hope I get this internship and I get to work with her.
oh.
So it's super cool to be here more than a decade later and,
Yeah.
have maintained our friendship and, yeah, our connection.
That's so awesome. Wow. Okay, so you did your pre-doc there. Okay.
I
And
know.
you have since totally evolved. I know that you've always had quite a bit of this spirituality piece, which is the reason that that's not the main reason, but the reason that I have created this channel is I wanted to bring more awareness to this holistic approach as
Mm,
opposed to the more Western talk therapy of healing. And so, you and I have both sort of evolved over the years to incorporate the mind, body, spirit component. And I know that you started it even before I'm pretty sure that I did because you were already, I think, into yoga. Anyways, I'll
mm.
let you talk about your journey in that process.
Yeah, so when I met you, I was in grad school for getting my doctorate in psychology. And during grad school in 2004 or 2005, I think it was 2005, I started practicing yoga after injuring my neck from repetitive stress, looking down at my textbooks. And so nowadays we call that specific injury text neck because people look down at their phones. But back
Yeah.
then, such a long time ago, before mobile phones became mini computers in our hands, I was studying for grad school so much, reading thousands and thousands of pages and loving it, but I developed this horrible pain. And when I went to physical therapy, not only did they teach me how to prop
Yeah.
my books up and, avoid stressing my cervical spine, um, I also started yoga at that time at the YMCA
Mm.
and just fell in love with it. And I have been practicing ever since. So about 20 years, I've been a yoga practitioner. Um, and so by the time I graduated with my psychology degree, it was a big part of my ongoing regular routine of self-care and slowing down and recovering and
Mm.
also energizing because the type of yoga I practiced primarily at the time is like vinyasa,
Mm.
which is a more active form of yoga
Yeah.
movement. So, fast forward, I became a psychologist. I went into private practice, continued to practice yoga. And over time, there would be clients who would come in that had their own yoga practice. And
Mm.
so it became natural to incorporate that into the conversation to let's take a moment and put our hands together in Anjali Mudra and breathe because
Mm.
pranayama or breath work is a part of a holistic yoga practice, not just handstands or whatever fancy stuff you see on social
Right.
media. And I felt like, anecdotally, those patients got better faster.
Mm.
And so initially, it wasn't so much as putting the yoga into the therapy experience as much as allowing it when it already existed in that person.
Mm-hmm.
But then over time, in 2014 and 15, I finally really wanted to be able to safely teach people how to incorporate yoga practices into their healing process. And so that's when I signed up to become a yoga teacher. And I did yoga teacher training with yoga medicine with Tiffany Cruikshank. And I picked her specifically because she's a licensed acupuncturist with a traditional Chinese medicine and sports medicine background.
Wow.
And her methodology of teaching was very structured and very clear and very grounded. And I just was drawn to her energy in that way. So I got certified, and then I felt comfortable. I knew now that I knew where the dangers were for people's joints, or how to understand people's pre-existing health issues in a more holistic, informed way. And then a couple years, actually right after I finished that certification, I immediately started an advanced yoga teacher certification locally here in the San Jose area with Breathe Together Yoga. And Jennifer Prue has been my mentor and teacher. And that's when I was able to more fully incorporate psychology and positive psychology into my advanced teacher training thesis. And so that's when I really took it to that next level. And I looked at the yogic philosophy, and I looked at the tenets of positive psychology, and then what are the positive outcomes, what are the risk factors, and I put it all together. And it became, much more in depth in terms of what I could do and how I could work with people. So that was a big part of me moving from very cognitive, not CBT, but psychodynamic and very cognitive rational types of therapy, where people came and they talked and they felt better, but it wasn't to me as clear, and it wasn't clear to them, like, what's making me better, right? And once I incorporated more holistic practices, there were tangible benefits, people reporting that they stayed calmer through the week when they practiced meditation, when they practiced breathing exercises. And now in this time in 2024, we know a lot more about the science of breathing and the science of the nervous system and the polyvagal theory and all those things that, 15 years ago were just starting to come into the conscious mind of therapists, not even pop culture. So we know why those things work. We know now how, and yoga has been researched so much more. We know a lot more about the actual research benefits, right? Like shrinking the amygdala and healing the telomeres at the end of the DNA, right? So that was one piece. The other major piece that brought me into a mind-body practice of therapy and psychology is that I myself went through a major medical crisis. And in 2015, I had been feeling really, really tired. And you remember me, and everyone who's ever known me, I'm a very high energy person. And anybody who would see me now on my Instagram or know about me or meet me in person would never guess that for 18 months, I could barely function. I was so sick. I had to cut back work. I had to hire household help. I had to choose between doing laundry or going grocery shopping. And if I went grocery shopping, that was it. I couldn't also cook dinner. And so for someone like me who was a person who, derived my ego, identity, and purpose through achieving, because thank you, Asian American parents, right? I couldn't be a high achieving person, and I had to really reevaluate what was making me sick, and also not just physically, but becoming more anxious, more depressed. And I had 3 young children at the time.
Yeah.
And, my twins, remember, they came into the world through IVF and then a NICU stay of 4 months. And so there was a lot of unresolved trauma that at the time, trauma was not a word that was common in our pop culture lingo. nobody told me, hey, you've been through a major medical trauma. You need to go to trauma therapy and make sure your systems are okay.
Yeah.
Um, and so the first 5 years from 2010 to 2015, I just was blinders on, survival mode, fight or
Yeah.
flight.
Yeah.
And by 2015, I was so sick.
Yeah.
And in that search, Googling, trying to figure out what was wrong with me, I finally came across an autoimmune disorder. And I said, oh my gosh, I have all 9 or 11 of the secondary symptoms.
Mm.
Every single one of these is registering for me. I mean, I was cold all the time. My brain wasn't functioning. I was extremely fatigued. There were so many symptoms. So at that point, it was like the light bulb went off and I said, okay, I have to heal. My family depends on it. My life depends on it. And I went to an acupuncturist. I went to a naturopath. I went to my normal doctor, my Western medical doctor as well, allopathic medicine, meaning disease focused. And the Western doctors, the allopathic doctors said, you're fine. Your thyroid numbers are fine. And I said, well, why is my hair thinning? And my skin is so dry, it feels brittle. And I'm freezing. I'm wearing a puffer, a down puffer in 78-degree temperature. I'm so cold. And I can barely think. And I know, I got my doctorate just within a decade, this is not normal. This is not normal.
Yeah.
So that's what drove me to the naturopath and to the Chinese medicine doctor. And the naturopath ran, 20 times, 100 times more labs. And that's when on one of those labs for thyroid, which the normal Western doctor doesn't always check for, is the antibodies. And then they were able to say, okay, you have Hashimoto's disease, which is an autoimmune disorder. And it was like, okay, finally, there's an answer. So in 2015, I got the diagnosis. I went through 2 months of weekly acupuncture to restore my health. There's lots of research benefits to that, so I felt good about that. And then I changed my diet completely. I did an elimination diet, and I found out all the things I was allergic to, in particular that were bad for Hashimoto's. And so I got rid of gluten and dairy and eggs, and I was terrified as a foodie. What the hell was I going to eat? But within a month, I was already feeling better. And I remember I came out of an acupuncture session. I could feel myself glowing, and I took a selfie, and I was like, oh, it's real. It's not just a feeling. I am glowing. And so I could see my health slowly but surely being rebuilt. And it took about 18 to 24 months before I felt I had normal pre-illness levels of energy, because I had destroyed my gut, and through stress and a year-long round of antibiotics during grad school, because I had been exposed to TB and tested positive, and the treatment is to take 9 or 10 months of antibiotic every day, with no regard to how that affects your microbiome, because microbiome wasn't a thing people talked about, right?
Exactly.
So I did start to get better. I healed my leaky gut. I still have sensitivity to gluten and most dairy, but I am healthy again. And those benefits to me really convinced me. And the more I learned, the more I researched. I actually got certified in complementary alternative medicine because I wanted to know for myself. It's actually come in really handy for my patients and for my clients, because most everybody is dealing with some sort of biological illness or stressor that they can make a choice about, that they can either immediately or gradually make a change to reduce inflammation in their bodies and begin the natural healing process can resume, right? Because our bodies naturally want to heal and grow. You just have to get out of the way. So that was another major piece of my holistic practice. The spiritual side, I would say I grew up in my teenage years. I became a evangelical Christian, so I had a very deep belief in God and religious, truisms and morals that guided me. And then as I got older and I got exposed to more belief systems and more people, my understanding and beliefs got challenged, and then they grew. And so my definition of God has grown, my definition of love has grown, and that spirituality was difficult to dismantle the existing system, to deconstruct is what it's technically called. But the reward of it on the other side is having this immense freedom and belief in a higher power that exists everywhere and in everyone, and that I am so blessed and sometimes even still delighted to get to participate in for my clients. And so it's very interesting to incorporate that aspect of healing and opportunity into the holistic practice as well. And that also includes some training I did 5 years ago with energy psychology. Did a whole host of training. And so you can sort of see this evolution that now I sort of use it all on the fly with people depending on what they need. And the one thing I don't do as much, because I now do video sessions only, and I do long distance tele-coaching and teletherapy. The only thing I don't do anymore is hands-on energy type work called neuro-emotional technique. But that also, 5 years ago when I got trained in that, was phenomenal, and it really expanded my understanding and applications for healing, especially because during the pandemic, there was so much trauma that was getting brought up, and I really dug deep in really making sure I was equipped to do trauma therapy, especially like EMDR type therapies online, and then incorporating energy work as well. So that is the story of my evolution from psychodynamic clinical psychologist to holistic health, mind, body wellness practitioner.
Well, thank you for sharing that. Quite a journey. It sounds like there were stages of it that you really dove into different aspects of that mind, body, spirit component. And I have a lot of questions, and each of those I kind of want to dive in a little bit, if that's okay. So
Definitely.
it sounds like there were a lot of challenges that sort of took you to that place of being so sick in 2015. But even before then, you were already on this journey in some ways, and that just kind of pushed you toward even more in exploration. You started off by saying the psychology combination of positive psych and yoga. Can you talk a little bit more about the overlap and what you mean by that?
Yeah. So positive psychology, for those who are not familiar, is really looking at positive human functioning, whereas traditionally psychology is focused on disease, disorder, dysfunction. And at some point, I think it was in maybe the late 70s, early 80s, somewhere around that time frame, psychologists began to say, wait, but what about resilience? What about all the people who are doing well, that went through horrible crap and they're okay? And then, like, what is that? And nowadays we call that post-traumatic growth. But back then they didn't have a name for it. And positive psychology is really looking at those factors that feed into and build the human quality of overcoming, rising up again. Brene Brown talks a lot about that ability, right? And so I think the main overlaps I'm not going to go too deep into it because, number one, I'm a little rusty on it, to be honest. And number two, the way that I did my thesis was around looking at the actual yamas and niyamas, which are sort of colloquially called the 10 commandments of yoga. And they're not really, but it's really the do's and the don'ts. And there are a set of values and characteristics that a yogi who is practicing should be striving to exhibit and to wrestle with. And those values overlapped with things in positive psychology that we've identified as resilience factors. So, like one example would, a really probably very important example would be svadhyaya, which is the Sanskrit word for self-study. And self-study totally goes along with psychology because the whole idea is to self-reflect and to gain insight, right? But often psychology stops with that. There's this assumption that change will now somehow magically happen because I understand myself. But I'm sure you and I and many other therapists and many, many people have gone to therapy and they understand what is wrong or they understand what went wrong, but they are stuck and they don't know how to get out of it, right? And so the neuroscience of yoga and the neuroscience of trauma healing actually overlap quite considerably. And that's where in positive psychology, the factors around resilience come into play. And so another example of a principle in yoga, a yogic principle is tapas. So applying heat. So we see that most frequently when people take a sweaty, hot yoga class, and they just sweat so much and oh my God, it was so great. I feel so cleansed, right? And you actually do feel really cleansed, just like if you were to go into a sauna and sweat that much, because that is your physical body's natural detox system. So in psychology, when we think of tapas, so let me back up. In yoga, when we're thinking of tapas, there is not just make it hard and do it because it's hard. There isn't this, there are other principles that temper that intensity, but it is the acceptance that intensity and hard work and the discipline and application of discipline and ongoing practice is going to be a component of the growth process. And so in resilience, you would say that would cross over to growth mindset. And what's the word I'm thinking of? Stress tolerance response, right? In psychological terms. So that's kind of where there are a lot of overlaps and people can begin to see that, oh, these two practices, these systems actually work well together. And then when I did trauma therapy training, then I saw it even more. I was like, oh, this is why yoga makes such a big difference for some people. And I won't say that if you're listening to this and you've never practiced yoga, do not believe that, oh, it's a magic bullet. It's not that simple, right? It's really not that simple. And that's because each person who has suffered a trauma is unique. And there are so many factors into what causes them to have trauma-related symptoms and functioning and even personality. But the long and short of it is that when you have had trauma exposure, your brain changes. And the neuroscience of the brain, what the research shows is that you get stuck in your emotional brain. And most people aren't stuck in their emotional brain 100% of the time, but there will be things, triggers that send you into fight, flight, or freeze, or another trauma response, fawning, people pleasing. And those patterns are physiological. And this is why I'm such a proponent of mind-body work, because there's no amount of rational talking that will ever convince your emotional brain, your limbic system, that you're safe and that everything's fine, because those memories, those trauma experiences are actually stored in your brain as a present day, present moment experience. Every time you think of them, it's actually happening to you in your brain. So, how does yoga come into this? If you have a physical practice that generates physical stress, physiological stress, so holding a posture for 20 breaths, it sounds like, oh, you're just hanging out there. But no, those yoga teachers, they're wise sages, and they came up with postures to put you in this interesting set of tension in your body. Mm-hmm. And so one of the yoga principles of Stiram Sukhamasana, meaning effort and ease, teaches you to be in a challenging place in your body, but don't push and don't resist. Just be there. And what makes it yoga versus gymnastics in these postures is the incorporation of the pranayama, the breathing. So you feel the breath moving in and out, usually nostril breathing, with heavy emphasis on the exhale, making an ocean wave like sound. Mm-hmm. And it brings a calming effect to you as you're holding this posture for a minute. And if you've ever practiced yoga and a teacher is talking and you're just hanging out there in this difficult posture, your brain is going crazy thinking, okay, dude, all right, lady, any ear now, my leg is so shaky, right? Well, in trauma, that's what's happening in the brain is you want to escape, flight, or you freeze, or you want to fight. You get upset about this situation. And in order to facilitate neural reprogramming, which is what most the successful trauma therapy approaches utilize, you have to engage your parasympathetic nervous system, right? You have to engage the healing, calming side of your nervous system. And how do we do that? Well, the primary way, according to polyvagal theory and all the science and research, is stimulate the vagus nerve. Mm-hmm. And guess what we're doing in yoga constantly? We're stimulating the vagus nerve through our breath, through the way we hold tension in the internal organs. There are these bandhas, these bands of energy. And so incorporating yoga and psychology and healing makes so much sense intuitively, right? Back when I first started. And then now, 15 years later, it makes so much sense scientifically. Mm-hmm. And that is such a good feeling because I know that the tools are there and they translate. And even when I don't teach physical postures, asanas, I can still teach pranayama. I can still teach meditation. There's still ways to incorporate it through video, not just like doing a yoga class that's, right, generic to a group of people, and isn't really customized for that individual. But if I did have for a time a studio / therapy space, and it was like a dream come true when I put it together. It felt like finally, like the two worlds were coming together. And there were times when I did have specific patients that were going through rehab or divorces or, I remember one time I had a teenager and they didn't want to sit on a couch and talk to me. They were like, can we sit on the floor? And I was like, definitely. And then they could open up, right? Because being on the floor like a child. And so those are some of my fondest therapeutic moments, is bringing in the movement in the body and connecting a person back to this container that we live in. We can't escape it. So we have to heal it and we have to optimize it.
Yeah. Yeah. Wow. What a great way to sort of work individually and try to figure out what's going on for the person and adjust accordingly, right? And bring in different aspects. Yeah.
Yeah.
I'm also very curious about this. You said, I think it was 2015 that you got really, really ill, and given, you're having your kids and the twins in NICU as well, that's a lot that you were holding in that journey, right? And so it makes sense that your body's just exhausted. And and that has, when that's held over time, it makes sense that you would get to that point of affecting your immunity, right?
Absolutely.
So I'm kind of curious about now incorporating, you went then into studying the Chinese medicine and getting certified in that complementary aspect. Can you say a little bit more about how you incorporate that part in your psychotherapy with clients?
I know, it's like, how can I incorporate so many things, right? I do a really intensive intake. So I do all the traditional psychological questionnaires and assessments for depression, anxiety, PTSD screeners. And I've actually done ADHD, and I've actually done more now that I work video wise. And also, even if I were to work in person, I would still give the same intake. And I always tell new incoming patients or clients that, hey, this is way more medical than your, just recognize that this is not the norm for how we're going to work, but I want to gather as much data as possible. I had a few experiences where, you work 6 months with someone and then they finally are like, oh yeah, by the way. And from a psychodynamic perspective, they just weren't ready to bring that up. It wasn't ready, right? But at the same time, people are really suffering. And especially during COVID, there was a lot of demand for therapy and not a lot of enough providers. And we were all going through it. And so I wanted to streamline the process as much as possible. So once I gather all the relevant information, so when I say holistic health, I mean, I get down to the nitty gritty of tell me about your poop. And they're always like, what? And when I was in the office, I actually had this note, like a binder for the intake, because I would be showing them the Bristol stool chart. And most people didn't realize, and still don't realize, your poop really tells you a lot about how healthy you are, because it's your microbiome, and your microbiome is this whole other brain, your enteric brain, right? And so once I learned about the microbiome and the enteric system, and how food and nutrition play a role in mood and functioning, and how it shows up, what kind of symptoms show up when people are deficient in this and that and the other, or over indexed on certain vitamins or minerals, then I could incorporate into the intake, tell me about your nutrition, tell me about your hydration, tell me about your alcohol use or any other drug use, tell me about your supplements and medications, and please list them and their dosages, right? So that's what I mean about getting really, really into the nitty gritty with people. And I mean, there was even one time when a patient was, you just learn a lot of things over the years. And there was a patient and she was taking like beta blockers. And then she was like, she was being so healthy. And she's like, I eat a grapefruit every day. And I was like, I don't think you're supposed to do that. Let me double check with Dr. Google, because I was like, I'm pretty sure that's a no-no. And I actually was right, because my knowledge base is deep. And yeah, she wasn't supposed to be doing that, and that we caught that, right?
Yeah.
And another time, a patient was talking about his symptoms, and I was like, I know you're depressed and you're anxious, but you also have had a sinus infection for 2 months. That's not normal. Please go to your doctor and find out what's going on. This is a long-term infection now. And of course, since it's chronic, you have inflammation, and depression is inflammation of the brain and the sinus in the brain. And turns out he had a raging bacterial infection in his sinus. And, a normal therapist would focus on the thoughts and feelings. It would not talk about that.
Yeah.
But my philosophy as a holistic practitioner is, how can I ethically really treat someone and charge them their hard-earned money for their work, that they worked for talking about their thoughts and feelings, if we ignore this biological container that either supports us or limits us.
Yeah.
Right. And so there's a huge biological evaluation. I don't go into their blood work. I mean, I can look at it and I generally have a sense, but I'm not certified in that. I feel like that's really where a medical doctor, I need to collaborate with them. And it's also another area of interest of mine that maybe someday I'll get certified, but it's, at some point we have to stop. We have to just be like, this is good enough. Let's just have a teamwork approach, right? But I love being a student. I love learning. So specifically with complementary alternative medicine, that means once a patient or a client has said, well, I went to my doctor and they said, I'm fine. And we look at each other and we're like, we know you're not fine because, you got all these other symptoms. But again, Western medicine is allopathic, disease oriented. It's not holistic. So it's looking. So you go to your endocrinologist, they're just going to look at that one thing and they're not going to look at the whole picture. So I will, depending on what's going on, I will make referrals. And so I have a whole database of local acupuncturists. And then if they live somewhere where that's in a different city, I will take time and I will look on Google, I'll look on Yelp, and I will, sometimes I'll even call and talk to the practitioner myself to find out, well, what kind of acupuncture do you practice? What philosophies? Because there's all sorts of subsystems. But I will refer out because we know acupuncture. So my primary kind of overarching goal is reduce inflammation, right? And then let the body's natural growth and healing processes get back online. So we can do that. We can reduce inflammation by changing diet, by making sure people are sleeping. So I go into it's not a sleep study, but I go into like sleep data with them. And I'll refer to naturopaths. And basically I'm willing to work like if, someone chiropractic care, energy work. So I will make referrals out for those kinds of additional treatments. Frequently people have depression and anxiety and even panic attacks due to physical limitations related to spinal injury or ongoing chronic pain. And from what I've learned is it's not all one or the other. It's not just physical and it's not just psychological, emotional. It's both. And I've experienced it myself hundreds of times now where I go with most probably within the last year. I remember I have mother-daughter type challenges as many people do when they, especially I feel like daughters with their immigrant moms, it's a particularly hard dynamic, right? And I went to see my chiropractor and I was like, I didn't even feel out of sorts in terms of my spinal alignment. And I'm very sensitive to physical sensations because of my training, both as a ballerina growing up and then as a yogi for 20 years. And then I'm also a highly sensitive person neurologically. So it's kind of that trait. But we were talking about my mom. We did psychological energy work. And then my neck went pop, 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 pop. And he didn't even touch it. And so things like that will happen. And then other people will tell me, oh, yeah, I went. And I've just seen so much. I've heard so much. And so there's definitely this really strong connection between the mind and body.
Right.
And that's where, with holistic health, I want to create as strong and healthy of a body. Sometimes that, usually that builds a resilience that then allows people to tackle the psychological stuff.
Yeah. Sounds like you do quite, like you said, quite a thorough assessment and you sort of learn over time what to ask and stuff, including the poop. That's awesome.
People just don't realize. Yeah, it's so important.
Talk about poop of our work. Like we get into the shit, if you will, of psychology,
totally.
But you get into the physical shit.
Yeah. And it's always so funny when they're like, sorry if this is TMI. And I'm like, nothing is TMI when you're talking to me. Nothing. And so I've heard a lot. And, it's important to, because we're creating a psychologically safe space for people. There's so much body shame around in our culture, right? And globally, I think that it's it's invasive. It's an epidemic. I was
Mhm.
thinking about, I resumed posting on Instagram recently, and I had taken like a really long, like multi-year hiatus during the
Mm.
pandemic because I was like, I have to conserve my chi, my energy. I can only put myself into a certain number of places.
Yeah.
So recently I came back from an international trip 2 weeks ago, and I caught a cold for the first time in years, years and years and years.
Mm.
It was just like a really bad cough, not much else. But I was jet lagged, I had a cold, and I was on my period. And I really wanted to post about that. And I was like, "Oh, it feels weird to talk about my period, even though why? Why am I? This is not, I should feel zero shame about that. This is a
Mm.
natural biological function,
Yes. Yes.
right?" So, when we create these safe spaces for people to talk about their bodies, it is already psychologically healing,
Yeah.
right? Yeah.
It reminds me of this whole movement. I started to talk about menopause and stuff,
Yeah.
and that's the whole movement in the media these days. I
Yes.
noticed, yeah,
Yeah.
which
Halle
is very
Berry.
healing.
She was just in the news, I think, last week. And like,
Mm.
absolutely. I mean, I'm in perimenopause, and we need to be empowered as women, because the healthcare system was not set up for us. And now we need
Yeah,
to take back control,
right.
and make sure we're aging with our health intact, not
Yeah,
just accepting that. And that's another piece. I think I live it, and I try to teach my patients and clients about this, is don't give up on your body. We not only have
hmm,
neuroplasticity, but you know, there is a reason. And even if someone has done every test and they can't figure out what's going on, there are still choices you can make to put more control back into your life so that you don't feel powerless. And
yeah. Areas where they do have
mhm,
control, right?
right. Yeah.
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 Well, I have a heck of a lot more questions. It sounds like you do a lot of education in your sessions.
Mm-hmm.
Yeah, which is great, and that's sort of my philosophy as well, because
Yeah.
these people come in and there's so much that's not available
Mm-hmm.
for them to access, even though there's Dr. Google, like you said, but there's also a lot of misinformation out there,
So
right?
much. And even with the advent of AI, now it's nice because they'll give you a little some AI summary of the findings, but you don't know if that's right or wrong. And so you have
Exactly.
to know, like, if the trusted source, like Reddit, is going to have a lot of opinions, but mayoclinic.com, right?
Yes.
Like places that are reputable. Yeah, it's
Yeah.
important. Yeah, and
Yeah.
empowerment, our job as therapists is not to keep them coming to our office every week.
Exactly.
Help them heal and move forward and come back
Exactly.
as needed, just like,
Yes.
and it's okay. Some people want to meet weekly, but then that becomes coaching, and that has to be a specific shift,
Yeah.
and a mindful, purposeful shift. It's not just hanging out. But a lot of
Exactly.
people don't know how to have healthy relationships in this day and age. And so, yeah, education
Yeah.
is empowerment.
Yeah. Well, I'm looking at the time, and I don't know if you have much time. I know we only allotted for an hour because I do want to ask more about this energy medicine as well.
We have time. I don't
Yeah.
have anything I have to do, and I told my kids to be quiet when they come home from school, so
Okay.
hopefully we won't hear like
Awesome.
chaos.
And
Yeah.
if we do, that's great too. That's
Yeah.
fine.
It's
I
real
have
life.
my dog, exactly, and my dog is in the background, well, barking at times. I don't know if you hear,
Nope.
but
No, Zoom is really good at editing out sounds. Like last
not
week
too bad.
when I had coughing episodes, my clients couldn't even hear it. They
Oh
could just see it.
wow.
Yeah, it's
Oh,
crazy. The
okay.
technology is amazing.
Oh good. Oh
Yeah.
good.
Yeah. So yeah, ask away.
Yes. So you then went into this exploration about energy medicine. How did you get to that? And because
Mm,
I mean, by that point, you already incorporate a lot of different
right.
aspects already.
Yeah.
So,
I had a whole like system, and I guess the way I got into it was because my chiropractor
mm,
became certified in this NET, neuro emotional technique, and he did it for me when I went in
uh,
about some body pain. And I was blown away. I was
Yeah.
so blown away. And then he knew that, he and I were good friends, not just, he wasn't just my doctor, but he was a good friend.
Mm.
And he knew that I had had a lot of interest in Chinese medicine and meridians and acupuncture. And so NET utilizes meridians and
Mm.
the five elements theory.
Mm.
And so it is this. I remember when I finally was like, yeah, okay, I'm going to sign up and do the basic training. I got there and it was like, holy shit, like it's all coming together. All these streams are coming
Mm.
together.
Mm.
And by then I had already experienced it a few times and
Mm.
seen the effect. And it was so just shocking because it's so outside our Western thinking.
Yeah.
Um, but the effects were, I knew I wasn't delusional, right? And all these other people in the room, they're licensed acupuncturists, chiropractors. They've gone through a lot of school. They have their doctorates. These are smart people, master's degrees, MFTs. Like these aren't, we're not in a group delusion here. So I was just enamored. And actually, it's funny because I was actually thinking about this last week. Like, gosh, I really, really, really miss doing NET because there's so much information in the body that's nonverbal. And I learned how to do muscle testing
Mhm.
and then connecting that muscle testing to the body's innate yes or no
Mm.
feeling of safety or not safety, right? Integrity, alignment. Um, so I got introduced to it through my chiropractor. I went to training. And after the first set of training, I did a couple more. And I remember at the first session, though, the founder of this system and this other acupuncturist who had been doing it for 20 years, because you would pair up with someone who was really
Mm.
experienced as a newbie,
Mm.
and they would work with me, and they just were like, wait, how many is, and they would look at my name tag and they'd be like, this is your first time doing this? And I was like, yeah. Why? And they're like, there's no way. There's no way. And I was like,
Mm.
oh, because I was prepped. And I remember saying to the founder, I was already prepared. I'm not new to this. Like I've already studied being a yoga teacher. So I know about touch and I know about energy, like kind of
Channels.
the feeling of what people's bodies is saying, what
Mm.
they look like. And I know how to touch people safely so
Mm.
that they feel safe, right? Because doing adjustments in yoga or being,
Mm.
I did a really dedicated, like, I want to say 14 months, maybe 18 months, where every other Saturday I was in the yoga studio just being the assistant and walking around the room and feeling
Mm.
people's energy and pausing and breathing with
Mm.
them and then helping them find their way into the posture in a way to release.
Mm.
Still one of my favorite aspects of teaching. And so with NET, I, brought in the yoga, I brought in the Chinese medicine element theory, and I brought in, and I had started studying EMDR at that time. That's what else. And so I started seeing that they're talking about similar things in different ways.
Mm-hmm.
The fight or
Mm-hmm.
flight,
Yeah.
the episodic memory versus,
Mm-hmm.
I'm blanking on the word, but that there is this physiological system we cannot override through
Yeah.
talking.
Yeah.
Right.
Yeah.
And then around that time, I think you were also beginning to look into energy psychology. And that's when you and I talked. This was about 5 years ago.
Mm-hmm.
And I just was like, well, what else is out there?
Mm.
And I learned through you and through looking that there was clinical EFT, emotional freedom technique, and they call it clinical EFT to make it a specific protocol to follow.
Mm-hmm.
So I did one of their trainings and I learned about the acupressure points on the face and how the research talks about how it shows it reduction in cortisol.
Yep.
I took a very brief introductory training around somatic Peter Levine. What's his somatic experiencing?
Mm-hmm.
And I wasn't as drawn to that because it was still, I felt like the other approaches were more pure energy and they were closer to their original sources, where now I have a word for what I felt at that time, but at the time I didn't have a word for cultural appropriation, but it didn't sit right with me that a lot of these westernized techniques that were getting credit, we were not acknowledging that they came from
Yes.
ancient,
Yes.
thousands of years old methodologies that were effective. And it was,
Yeah.
and now we have the word of cultural appropriation, but back then we didn't.
Yeah.
And so now I can look back and say, oh, that's what I was really uncomfortable with, was there was a lot of cultural appropriation that I was like, isn't this just Chinese medicine? Like, packaged up differently in some aspects, right?
Yeah.
So that's how I got into energy work. And then I felt that it was also happening at the same time as my spiritual deconstruction and reconstruction.
Mm-hmm.
And I had specific spiritual experiences that you just can't explain through logic and what we and I found theologians who were more open, and they were Christians, and they're called Christian mystics. And so I began to learn from Father Richard Rohr, ROHR, who's a Benedictine friar, and really opened up my mind to the reality that if we want to identify with God or a God, that we also have to recognize that we're putting a human limited understanding on something that is by definition boundless. And it was just such a revolution in my mind from this God is Jesus. You go to church every Sunday. And so it's really this evolution into energy, and then studying a little bit about quantum physics, not a lot, but studying a little bit and starting to see how at the quantum level, there is a system. It's irrational, which is the word, which doesn't mean it's irrational. Right? Irrational is it's oppositional to rationality. Irrational means it's outside of it. And so I had these various inputs of data and perspective from theology and science and personal experience and training. And it all ended up merging into this experience and practice with energy. And how it applies for work. So previously, I'm going to assume you wanted to know about, so stop me if you don't. But how it applies for my practice is that certain clients are more sensitive and more open to spiritual matters or energetic matters. They'll either bring it in, or I might share a teeny bit and just see, is this relevant to them? So it's never something that I dump on someone, because I'm always waiting as the therapist in the room, as the healer that they've come to find safety, is to wait and see. And so when I learned NET and I was in the office and practicing, I would offer it. And if somebody wanted to do it, we would do it. We'd go through the whole protocol, and wow. I mean, energy work shifted my perspective on what healing was possible, because therapy takes a long time. Is such a common misunderstanding. Well, I mean, if you're doing talk therapy, it's going to take a really long time. But if you're doing energy therapy, not necessarily. And that's related to, again, the trauma brain and the understanding of that. So I would do NET in person, and then I could do clinical EFT through video or in person. And then with the pandemic, I switched all to video. And there are ways to guide someone through a self-healing form of NET.
That's what I was wondering. Yeah, I would assume so.
Yeah. And I don't know if they've evolved any other techniques since then, but in the beginning of the pandemic, I even worked with one person who had broken their back and was going through rehab. I mean, they almost died from a biking accident.
Oh my gosh, wow.
And when it came time to do healing, to go back to college and to get back on the bike. So we did what we would now call like graduated exposure therapy around the bike, but with parasympathetic activation and using NET and visualization. So we, through visualizations, we did the exposure therapy component. Through the acupressure points, this is the posture for NET, we did the deep breathing. And then I think the thing that is the most fascinating to those of us who are Western medicine trained is that we just really don't understand enough about consciousness and memory and the brain. And so the way the brain is organized is really fundamentally different than what people assume. And so it really was beautiful to be able to guide someone through NET through video. And the verbiage I became familiar with, guiding them. And that's where the yoga teacher part of me is like, all right, everybody, let's take a deep breath, create some space. I was used to guiding people. And actually, sidebar, but related to therapy and coaching, is that I always start with meditation. A brief guided meditation is always part of the protocol until the client requests that they don't do it. And if they don't want to, I don't make them. Right. But so they are used to me guiding them through a meditation where they're practicing interoception and feeling into their body, which in and of itself is very healing. So with the NET, the people would always say the same things. They would go in, they would be breathing and waiting, and there's no right or wrong there. It's just very open, non-reactive, non-attached, right? Very Buddhist. And then we would come out of it and would say, if you saw anything, if not, no worries, let's move on to the other side. And they'd be like, well, I don't know if this is relevant. And then they would go on to share about some deeper, older memory that was completely relevant and algorithmically matched what they were struggling with.
The theme,
The theme would come up. And that just happened so many times. And it was so awesome that, I loved it. And that's the thing that I miss the most. And I don't have a way of providing that service in person right now because I don't have an office anymore. But I have been wondering, I know there are other energy techniques where you can actually do muscle testing on yourself to test for the other person with their permission, because I've had that done for me. And I have been thinking about that might be a way for me to get back to that work. So energy work is for those who are open-minded and who generally those individuals tend to be a little bit more sensitive. And they're very eager to see change. So they're very open to that.
Well, I see energy medicine, energy psychology is very broad umbrella. And I usually don't even use the word energy to introduce it. I just talk about, well, I'm going to teach you tapping if you're interested in that. And I talk about it's been found to bring in the parasympathetic, and it real sort of, so I do the little bit of psychoeducation to talk about, the findings of it. And afterwards they're like, I don't understand, what was that? And how does it work? And
how do I feel better?
Exactly. What happened?
Yeah.
And it's not surprising, like you said, like, as we tap and their parasympathetic brings them a little bit more calm, that then other things come up, like deeper memories surface,
Yeah.
right? It feels safer
Yeah.
for that to come in now.
Yeah.
Yeah. So I do love that work. Yeah.
It feels so satisfying.
It does. And I think you're starting the sessions with meditation is very grounding as well. I would
Mhm.
imagine, it kind of helps
Yeah.
center them so that they could be ready more for that deeper
Mhm.
work too.
Yep. Yeah.
Yeah. We
Yeah.
could talk more about muscle testing because I actually teach clients how to do
Oh.
it on themselves.
Oh, okay, cool.
Sometimes it works, sometimes it doesn't, depending on, how balanced their body already is,
Yeah.
their energy
Yeah,
system.
exactly. If they're
Yeah.
very stagnated, it would be difficult.
Exactly. And so there's a lot more steps to get them more balanced for that to be
Yeah.
effective.
Nice.
Yeah. So awesome to hear like all these different aspects that you bring in and your excitement and passion for this. I'm wondering, because you talked about wanting sort of this desire now of, you get a little bit emotional talking about these different stages, it seems like, of your
Mm.
exploration and development and learning and incorporation of these different techniques, including what you were just saying about missing that in-person, the office component. I'm wondering if that's something that you're going to consider at some point to bring that back in.
Me, like I mentioned before we started the official interview, like I have 3 teenagers right now,
Yes.
and it's it's something I'm holding to that I'll do. I'll offer more services
Mm.
when they are older, and they are
Mhm.
because I believe they're in a mission critical time of development, right?
Mhm.
Between middle school and high school, and then they're gone. They're adults into
Mhm.
the world, and
Yeah.
I believe this is my make it or break it time to be fully present
Mm.
with them.
Mm.
So I actually have cut back my availability down to like 15-20%. Like I only have 8 hours a week that I'm going to do
Mm.
clinical work.
Mhm.
And I put on my mom hat all the rest of the time and wife hat and all the other things I do. There's just like, we're remodeling our house and all that. But, you know, I, I think as they're getting older, they're becoming more independent, hopefully making better choices. I don't know, because I just got a call from the school vice principal, and it could be good or it could be bad. I don't know. They're teenage and they're boys.
Yeah.
The boys are the older ones. But for now, I'm focusing on my family and making sure that my children become compassionate, productive citizens of the world, because we need that.
Yeah.
And
Yeah.
then the things that I can offer now, because I was actually thinking about this starting last week. I have clients in different places in the world for
Mm.
coaching,
Mhm.
and I have therapy clients here in California.
Mhm.
And I was realizing that there is the healing power of presence, right?
Yeah.
So
Yeah.
one of my mantras and my catchphrases, I guess, is presence, peace, joy. So
Mm.
when, as I've been thinking about working directly with people again, I realized as effective as I am through video, which I think I'm above average effective because I have had media, a media degree, and I'm a highly sensitive person, so I can really pick up a lot, even when, I'm just seeing their torso. Um, I realized that there is a healing power in being fully physically present with
Yeah.
people.
Yeah.
And so I've been thinking about how could I do that? And so locally, and I've always offered this, no one's ever taken me up on it, but I've always offered it. Like locally, we could do walking and talking
Mhm.
therapies, or we can find a quiet park,
Yeah.
um, and meet there and do sessions in person, um, or a hiking sort of, there's just a lot of variety once you leave the office and you realize that therapy is not necessarily a couch based activity. That
mhm.
healing can come in so many forms.
Yeah.
So those are things that if I were working with someone long term and they were healthy enough, I would certainly offer that. And that's where that's why I've been thinking okay, if I was going to offer that, then I should brush up on my NET skills so that I'm ready to do NET. I can do NET if it's a quiet, safe place, right? Yeah.
Yeah. Okay. Well, thank you for sharing all of that. I'm excited for it. It sounds like you have a busy life. And it makes a lot of sense to want to prioritize this time with your children, the
Yeah.
important age, transition that they're in.
Yes.
That's a lot that you're holding just in that of itself as a job,
Yeah.
right? Yeah.
I feel really, really lucky. Really, I have a lot of gratitude for, I really wanted them, right? I went through IVF to have a family. And it has been a healing process for me because I've had such trauma in my family of origin. And so to be able to create something new and something healthy is so redeeming
Yeah.
and healing for me.
Yeah.
And it is a lot, though. It is a lot. But they're really great kids too. So it's like we're at a fun place, and we're in a fun place. So that's nice.
Well, I'm sure they're great kids too because of your presence, right? And you're changing that intergenerational transmission.
Yes. I mean, I'm actively, and sometimes they're way too sassy, and sometimes, but it's okay, right? Like, we're not here to create little robots. I want them to, and anytime you're growing someone to be an independent thinker, they're gonna think independently from you, your mom, as the mom. But I feel like when I was abroad a couple weeks ago and I texted them pictures and things, and there was just a warm response, like especially from my daughter and the boys, and each kid would text me about different things, like, "Oh, I sprained my ankle again," or "Oh, this," and it just made me realize, like, oh, they feel safe to talk to me. You know what? We're doing okay. Like, we're gonna be okay. Like, we're on the right track. And for me, I think there's a lot of power in being a parent who is practicing secure attachment and healthy, positive parenting, because it's not just healing and good for them, but I think my patients and clients feel that maternal healing energy. And they get to benefit as well, right?
Well, it speaks to the amount of work that you've been doing on yourself too, right? On your own healing journey and the extensive work of that.
Very extensive. Not by choice all the time, but certainly
we get forced into it sometimes.
It's happening to me and for me. It's kind of what I say is this is happening for me. Not to dismiss, but to fully grieve, fully mourn, fully be angry if I need to about the injustices that I've had to deal with. But then to just recognize, like, if I hadn't gone through everything I've gone through, I couldn't do what I do to bring healing to all these hundreds of people that I've had the privilege and blessing to work with, right? So this is my job.
It speaks to, you really, it's not just your own healing journey. You really went and sought out all these education and growth, right? And expansion. To be able to provide what you provide. So
it's an interesting process. Like, it was really because I was lost and I needed answers. And then once I got more information, once I learned, then I could share it. And so each thing I'm curious about, each thing I've wanted or needed to learn has come into this profession of healing in different ways. And so it does give me a lot of flexibility about who I work with and how I work with them. And so that also makes the job more fun, right?
Yes.
The
Yeah.
career has more sustainability long term when it's
Yeah.
got variety.
Yeah. Yeah. And you grow and expand too. Yeah.
Hmm.
Well, is there anything that I did not ask that you would like to share
Let me think.
more about? We'll certainly have your contact information and, all that.
Yeah, I
Yeah.
don't think so. I feel like I covered the journey and the applications, and I think, you know, yeah, the benefits. Yeah.
Thank you for being so vulnerable and so much willing to share your journey, actually.
Yeah, you're welcome.
Really appreciate you describing all these different aspects.
Yeah, it is a lot. When I put it all, I don't actually think about it all together in 1 hour. And when I
Mhm.
do an interview like this, I'm like, oh yeah, that was a lot
That's a
that
lot, yeah.
I went through. Um, but I think that, we're human too, right? And
Mhm.
I really do believe we derive our healing power as a therapist and as a person through our own authentic experiences, right? And so for
Yes.
anyone who is watching this and just thinking, if it's like really cerebral, there's a disconnect, right?
Yeah.
And like the heart of it is that I'm just like everybody else. I've had
Mhm.
hurts and I've had suffering, and I will continue to have suffering and hurt. And it's really not about eliminating that so much as
Mhm.
rising above or surfing along it or incorporating it, knowing how and when. Um, and I think it's important for people who are seeking answers to know that, you know, I was also lost at some point,
Mhm.
right? Yeah.
I have this image of like I don't know if this is even accurate, of like a kung fu master, or energy worker that's sort of as a person is navigating their own stuff, they're sort of shifting this energy or a river of water. And as we learn how to shift that, we're sort of sharing it with others, that other clients that we come in contact. So we're just a little bit ahead to be able to share what we learn
Yes.
in our little way of healing.
Yeah, exactly. And it does
Um,
seem that the universe brings, like, there's like somehow the self-selecting group, or it's the energy that attracts the right people to work with me,
yeah,
right?
that's a
I'm
really
sure
good
you,
point. Yeah.
yeah.
I was just thinking about that and I forgot to ask you about that. Like, what type of people do show up because you have such a different mix of as a
So,
therapist, right?
yeah, it's really kind of random lately. One, I stopped marketing last year because I didn't have any real bandwidth. And now it's usually like word of mouth referral. And so it's usually, I would say the trait that most people have in common is that they are very high achieving and
Uh,
intense. And
mhm.
then a large percentage of people are neurodiverse. So they
Mm,
are, you know, blessed and challenged in that way. And so,
yeah,
but having a family like that myself, my family is neurodiverse.
yeah.
Um, it really seems to attract that kind of really smart, capable, hardworking person who, performs or people pleases for their value and
Mm,
worth.
mm,
Um, Sometimes there's like serious health issues that then I can
mhm.
help them with. And sometimes it's like was it 2 years ago? I had someone who couldn't stop hiccuping. Like,
Oh, wow, fascinating.
yeah, and um they found me and they just felt like, I don't know, I tried to get help from everyone and it just hasn't worked. No,
Huh.
the doctors just say live with it. And she's like, I can't, right? So I genuinely believe, like, if someone at this point where I'm not marketing and I'm not advertising contacts me, then there's something
Yeah.
there that is supposed to happen, right?
Yeah.
And
Yeah.
and I don't make it like, oh, I have to meet their needs. Like right now I have no availability, but at least I can talk to them and I can point them
Mm-hmm.
in the right direction.
Mm-hmm. Mm-hmm. Awesome.
Yeah,
That's great when it's all word of mouth. That's awesome.
exactly. Yeah.
Yeah. Yeah. Well, Dr. Sophia Lin Ott, thank you very much for all answering all my very different questions and sharing so
Welcome.
much.
This was really fun. It was
Yeah.
super great to see you. And
Yeah.
maybe when we're done with this, let's make a date to see each other in real life.
Oh, yeah, for sure.
That would be great.
Yeah, and I'm sure as you evolved, maybe we'll catch up again some point in the future to update the audience and
Oh, yeah,
others about
definitely.
where you are. Yeah,
Sounds like a great plan.
I love that. All right, well, we'll conclude for now and we'll catch up.